pleased to be among you today to discuss this new protocol for hyperacusis that this amazing team and I have put together. This team consists of Dr. David Eddins, Dr. Peter Hutchison, Dr. Cherri Secor, Dr. Craig Formby, and Steve Armstrong, and myself. So, well, as we read through the hyperacusis articles, we realize that there are many, many definitions for hyperacusis. And actually, there's this review article written by Rich Tyler and his collaborators talk about these different definitions and put a summary on what we should really focus on. So knowing that hyperacusis is reduced tolerance to suprathreshold sounds, these authors define hyperacusis as 4 types. They define them as loudness hyperacusis, misophonia, phonophobia, and pain hyperacusis. And so there actually, let's go back to 1998, where Samit et al. Developed this amazing study that it was published in Scandinavian Audiology, and they talk about how to treat hyperacusis using loudness suppression devices. And as the name indicates, loudness suppression, they suppress the output from the device, so they suppress loud sounds from coming into the patient's ear. And actually, this study, it should have been given more importance than other studies, although it was done a long time ago. But so what they found was that patients had wider dynamic ranges at the end of the study. But the data that they had was not significant enough to make the treatment clinically viable. So it's true they did not solve the whole problem for hyperacusis, but it was a very good approach to start with, which is why we are picking up this approach and evaluating it using modern technology and our own ideas. Now, one of our collaborators, Dr. Craig Formby, also did another study in which they evaluated the combination of sound therapy and counseling. This study emphasizes the importance of combining counseling in our treatment protocols. So first, let's explain what we're looking at here. On the x-axis, there are the intensity level, and on the y-axis, we have the categories or the loudness judgments of sounds from the patients, ranging from very soft to uncomfortably loud. We have the blank circles present pre-treatment, and the filled circles present post-treatment. And what we see is that there's an almost 20 dB shift from this time, from pre to post. They're actually evaluating the category 6, which is loud but okay, and category 7, uncomfortably loud judgment. So they ask the participants to say when sounds get to these 2 levels. And we can see that after treatment, after the sound therapy and the counseling, the shift was about 20 dB. And they also measured the LDLs, which we refer to loudness discomfort levels, and they also found that LDLs were increased post-treatment. So, which is why we created an adaptive hearing aid fitting protocol, with which we are testing. So we all know that the dilemma with people with hyperacusis is to wean them off of their earplugs with severe hyperacusics. So our fitting protocol starts with replacing the earplug that they were wearing prior to the study with an earmold that functions as a really high quality plug. And then we connect this earmold to a device that has multiple functions. First, it has a sound generator, which emits a soft seashell-like sound, and also has amplification. And we can use this amplification in a couple of different ways. The first way we can use this amplification is by achieving unity gain, which means we give enough amplification to overcome the earplug effect. And so, when we do this, then we give the loudness suppression, which is the output limiter. Again, loudness suppression, it suppresses loud inputs from coming into the patient's ear. And of course, this is a measure that we get from the patient. And then we set this loudness suppression at a category 6, loud but okay judgment. Then we expect to release it over time.
Could you turn your microphone just...
That?
Yeah.
I'm sorry, okay.
Better.
Okay, I'll be like that. Thank you. So we set the loudness suppression at a loud baroque judgment, and we expect to release it over time, which means that as we expect that the loudness suppression level to be higher at the next visit, because we will be relying on the sound therapy, the treatment, which will be the sound generator. So we will rely on the sound generator, that emits the seashell-like sound, to begin the desensitization process and offer the treatment, which will therefore expand the dynamic range. The sound generator is going to be at a category 3, which is comfortable but soft judgment, and it will be stable because it's the treatment. So then after that, we release the output limiting, again the loudness suppression. It's going to be at a higher level. So at each visit, we expect this category to be higher. Then, which is our goal, we wean the patient off of the earplug, earmuff, or any other kind of an output limiting. Then with this expanded dynamic range, if these patients had hearing loss, we can use this amplification also to give them more gain, to prescribe gain for their hearing loss. Now, in order to offer the treatment and in order for the treatment to be successful, there's something very important that we need to consider: counseling. Counseling is a really important part in our fitting protocol, and we took the counseling script from the one developed by Gold and Formby, and we developed it even more. And the counseling script is very structured. It is composed of 4 components. The first component, we give an overview of the counseling appointment and the audiometric results. So we just discuss with the patient, with the participant and or the patient about his treatment results. For the second component, we just give an overview of the anatomy. So we briefly describe the structure and function of the auditory system, because when the patients know more about their case, they will trust you more and like to offer the treatment with them. And then the third component, which is a very important component, we give an overview of the central auditory gain, in which means we describe to the patient that the subcortical areas in their auditory system are the ones responsible for the gain adjustment to sound. Hence the name neural gain, because we assume that hyperacusis is because of an increased neural gain in the system. We're going to emphasize on this point even more. And also, these subcortical areas are responsible for that perception and prioritization, because for these patients, for hyperacusics, their system emphasized or give prioritization to sounds more than others. And then we also discussed the gesture buff model. We took this model and we elaborated on it to explain more to the patient. We kind of put it in a diagram, which I'm going to show you. We developed it more because we wanted to explain the desensitization process that the treatment offers. Now, the fourth component is about the role of sound therapy. We explain to the patient how the sound therapy, like the counseling and the sound generator, offer the treatment and how the neural gain is going to decrease over time. Okay, so also after having explained the roles of the peripheral and central auditory system in hyperacusis, we start by explaining the normal gain system, in which, so from external source up to the subcortical areas to the cortical areas for perception and evaluation. And as we can see, there's a dial that is set to 0. This is how we represent the gain in the system. Gain that is set to 0. There's no increase. All sounds are coming in and coming out. There's no increase in gain. That's the normal gain system. And then, so the loudness, the hyperacusis system, it is the same as the normal gain system, but there's an increase in the neural gain, as you can see by the dial. The dial is increased. Also, people with hyperacusics are more prone to develop misophonia and phonophobia. And this is what we show here. We show the connections of the limbic system and the autonomic nervous system with our auditory system, to show how there can be emotional associations or other physiological responses to sounds. And also, we are talking about neural gain again, so that we wanted to show that the dial is increased here. there's still an increase in neural gain. And then, for the treatment, if we want to rely on the treatment and for it to be successful, the habituation process is going to begin. And we show how this treatment, if we followed it correctly, it starts by breaking the connections with the autonomic nervous system, which is responsible for developing phonophobia, and then which continues and breaks the connections with the limbic system, which is responsible for misophonia. And then as this is going, the gain in our auditory system is being recalibrated or rehabituated. But also it is important to mention that these two habituation processes are not the direct result for the recalibration of the gain. In fact, all these habituation processes work together to finally offer us a normal gain system in which the dial is set to 0, there's no increase in the gain. Now, this is the device that we use to do all the programming. This is a mini BTE behind the ear hearing aid that the patients wear, and it has a heat-activated stent. This novel heat-activated stent, it actually helps with the attenuation, and it expands in the ear canal of the patient based on the body temperature. It also, this stent, the earmold comes in 3 sets. The first set is that they use in the field when they're wearing the device. Another set that we use for real ear measures. So real ear measures it's a verification technique in which we use a probe microphone to put in the patient's ear, and we get measurements. We can get these measurements unoccluded and occluded. We do real ear measures often because we get, this is how we are getting the resonance of the ear canal and the direct responses from the ear. So this set comes with a probe tube. This alone is only for the testing. And finally, it comes with a third set in which they can use, if they don't want the loudness suppression, they don't want this output limiting, because they're not expected to be exposed to loud sounds, they can use this with a thin tube and an open dome. It just gives them more comfort. Also, this device uses MEMS microphone, and it's assembled by JHI. Now, this is the software that we use to do all the programming. It's actually a custom software that we created to offer all the treatment. And actually, it gives us a lot of information about the sound generator and about the amplification and loudness suppression. So because this is a research study, we have protocol tabs. And these protocol tabs gives us all the information we need. Now also, we collected the same measurements on an acoustic mannequin, which we call HEMOR. Well, we do this because we will have the thresholds and the LDLs, loudness discomfort levels of the patient, and we put them in after having their responses. So then what we do is that we compare our measures with HEMOR because we want to see if there's any deviation. If there is, it means there's something wrong. So we have like basic measures that we compare our measurements to. And here's where we manipulate the level of the sound generator and the level of the output limiting, all based on the patient's response and reaction. Also, a very important part of our fitting protocol is that we have real-time data sharing between the custom fitting software and VeriFit. VeriFit is where we collect the real ear measures. We want to establish the real ear canal resonance and all the other measures. So we have the connection with the computer and the VeriFit, like they speak to each other. Also, so we also have this model of hyperacusis in which also we explain to the patient. We talk about how a person with normal sensitivity perceives sounds from very soft to uncomfortably loud. Then we present the hyperacusis, how they present sounds. For them, they can hear very soft and moderate levels normally, but when they get to a loud baroque level, for them it's uncomfortably loud, and the uncomfortably loud sound, for them it's intolerable. They definitely cannot be near them. So with earplugs, of course, when patients go to their first solution and wear earplugs, they cannot hear very soft sounds. So they are not hearing these soft environmental sounds in their lives. and they can hear the comfortable and loud but okay at soft and comfortable levels. But when they get to the uncomfortably loud sounds, they hear them at a loud but okay for them. However, and this gives them comfort. So this is what we tell them. If they wear the treatment device, they will be able to hear the very soft sounds, so they're not missing any important environmental sounds. And comfortable sounds, of course, they can hear them. But when they get to these uncomfortable loud sounds, they're going to hear them at a loud but okay level that they set personally. So that's what we show. We show that with earplugs and with the treatment devices, they will not be exposed to loud sounds that they consider uncomfortable. And actually with the treatment devices, they will be able to hear all kinds of sound, ranging from very soft to loud but okay. So this is the protocol of the study. We start with an intake, and then we fit them with the loudness suppression and the sound generator, and then we collect all measures, LDLs, and also speech tests, and all other measures that we need and we have to give to the patient. So our outcome measures. And also, as you can see, the counseling is given at 3 different stages, because again, counseling is very important and it is a very, very important part of the treatment. For the project status and timeline, everything regarding hardware, software, and protocol development is completed. We are recruiting moderate to severe hyperacusics, and the data collection is ongoing, but for the extensions, how many extensions we have done, given the complexity but the beautiful process of this project. So now I have come to the end of my presentation, and I'm ready to take any questions.
Is the sound generator going all the time while we're wearing this device?
Okay. So the sound generator, yes, it is set at a soft level, and it should be worn for 8 hours a day. So they have to wear it all the time because we have to give it time. We have to give time for the desensitization process, and it is the treatment that we rely on.
But won't the sound generator then stop them hearing soft sounds? You said in your illustration you said they could hear down to 10 dB, but if the sound generator would prevent them from hearing such sounds, wouldn't it?
No, actually it is set at a very comfortable level, and I actually tried it. It is soft. It is soft. It's just a seashell sound. It is set at a soft level. You are going to hear all the other sounds normally, even with the sound generators.
Well, I would have thought if you can hear the sound generator, it will stop you hearing very soft environmental sounds. Certainly at 10 dB, I would have thought.
Well, yeah, all the time, even like sound generators, when we are paying attention to the sound, we are going to hear it. But as we go through our lives, if we don't pay attention to it, we won't hear it as much as other times. So yeah, it is not supposed to mask other environmental sounds, and this is what we pay attention to.
But you don't have a control group.
We don't have a control group, no.
So it will be difficult. I mean, if it works, you won't know whether the success is due to the counselling or due to the sound limiting in the device, or whether both are crucial and what aspects of the counselling are crucial.
Yeah, but we do take baseline measures, so this is why it's like a longitudinal study, because we want to compare these participants to how they were at the beginning to where they ended. So like they will be their own control for them. So the baseline measures and the outcome measures.
Yeah, but what I'm saying is you won't at the end know what aspects of the treatment are critical.
Oh, okay. Like individually, like
Yeah.
the sound therapy or the counseling? Yeah, we expect them to be together.
Does it matter if you explain the Jastroboff model involving the limbic system? You won't know if that's a key part of the whole thing.
Yeah, that's true. But it's how we think that when we explain to the patients more about their case, they'll be able to trust you to give the treatment. And also the placebo effect, in which like sometimes patients, because like they know more, they can just it's a treatment that's based more on the psychological aspect of the patient. So this is why explaining every process and also explaining the Jastroboff model is just to give them more idea about where they are and where we want them to be.
Right, next question in the back, please.
Hi.
Are you saying that you're coming up with a sound generator where people can actually choose what level they want to hear and what level they don't want to hear? Oh, sorry. Sorry, hi. Are you saying that you're designing a custom-made noise generator for the patient to decide what level of sound they do or don't want to hear or expose themselves to?
Mm-hmm. Okay, so
have I understood where you're coming from? I'm a hyperacusis sufferer, and I've just shown up here today. I'm not studying or I'm not in the jobs that other people are here.
Yes. Okay, so the sound generator, it is set at a comfortable level that the patient decides, because as we go through it's a contour test in which we ask the patient to rate the levels of sounds, so rate the loudness from very soft to comfortable to loud but okay. And when they decide that this sound is set at a comfortable level, this is where we set, it should be actually comfortable but soft, not only comfortable. So when they say that this is the level, this is where we set the sound generator to be. And it stays there for all the treatment protocol.
I'm slightly concerned about companies controlling people who live with hyperacusis, saying that if you wear these noise generators, you can work for us in certain environments. I'm concerned it's not about the person, and from my lived experience and having received treatment, you are talking about safety-seeking behaviour through using a noise generator to do that, and listening to the American speaker and also being aware of things like legal insurance and health and safety in workplaces and stuff like this. How much is now being driven by businesses wanting to so-called protect their staff. I'm probably diversifying quite a lot in what I'm saying, but that's what I'm picking up from being here an hour and a half.
Yeah, I get what you mean, but so this is why this software is custom made. So sure, we want all manufacturers to use the same protocol that we created, because it's coming from a research study. But also the sound generator is set based on what the patient wants. And this is where we are going. This is the path that we're taking. So,
sorry to go on, but about when you say what the patient wants, it's also quite good for the patient to go into the fire a little bit higher in certain situations in life, because they are exposed to situations in real life that they can't control.
right.
Hyperacusis catches you out all the time if you're not wearing protection.
So this is why we want to wean them off of the earplugs, because earplugs, they would be reducing the input from their environment, and this is not good for the neural gain. So this is why with the treatment device and why they're wearing the output limiting, they will not be exposed to these loud sounds that they consider uncomfortable. So they can actually go to other situations where they're comfortable with. So they won't be exposed to loud sounds. You know what I mean? So they will be able to hear all sounds from comfortable to loud but okay. So this is the way that we want to go. We want them to be exposed to the situations that, in fact, they cannot go. As you said, they cannot control the environments around them. So with the devices, with the output limiting, they should be going and more freely, and wearing the sound generator over time, which is going to offer the treatment.